Many people think of asthma as a condition most common in children, but the reality is that asthma is also extremely common among seniors, and it can cause serious health problems. Joining me now to share asthma-related health tips is Baptist Medical Group board-certified family medicine physician, Dr. Marta Jacenyik. Thanks for being here.
Nice to be here.
Well, tell me a little bit, before we get into talking about asthma, tell me a little bit about yourself and your practice.
I'm originally from Australia, and I'm a board-certified physician. I came to the States and did a residency in Milwaukee, Wisconsin, and I've been in the Gulf Coast about 20 years. My husband is a firefighter. He has asthma, and my daughter has asthma, so it's kind of...
You are an expert for many different sides of the issue. Well, tell us a little bit, what is asthma exactly, for those that may not know?
Asthma is a disease where you have inflammation of the air tubes of your lungs, so that air has trouble getting in and out. It makes you more sensitive to triggers, lots of triggers, and that can be a cold, exercise, allergies, and when that happens, your airways tighten up.
How does someone suspect that they may have this, and are there asthma-like symptoms that may be maybe a cold or pollen? Are there other things that could be confused? I guess that's my question.
Well, particularly as you get older, it can be confused with other things. Usually people have a cough, might have troubles particularly at nighttime, chest tightness, wheezing, being short of breath, and that there are other things that can be, particularly if you're an older person.
Mm-hmm. Well, you're right on track with our questions here about older individuals. How can this really impact their quality of life?
Well, if you can't breathe, that's a big deal. If you can't sleep because you're coughing or you feel short of breath, it is a big deal.
Okay. What are there any other symptoms that they might see or experience?
I think I mentioned the four most common ones being cough, shortness of breath, chest tightness, and wheezing, probably the most common ones.
What do you see most in your patients? What do they tend to, at what point do they come to you or to another physician maybe?
When they're feeling short of breath or cough, that's pretty common. Those are the two most common things.
Mm-hmm. Do they feel, is this something that can be treated?
Yes, and do you want me to go on?
Yeah, yes, please. What kind of treatment is available?
There's basically two kinds of medicines we use for asthma, and if you have problems more than once or twice a week, you should be on what we call controlling medicines, and they help you not have symptoms. And then there's what we call the quick relief medicines that you take if you're having a problem. And usually one of the things I tell people, if you're having more of a problem than you normally do, your quick relief medicines aren't working, we normally put people on steroids like prednisone, and a little bit early helps prevent lots of problems later or ER visit.
When you're talking about medication, is this pills, sprays? What type of medication?
Most of them are sprays, inhalers or nebulizer.
Okay. So are there any tests that you run to determine, or is it just based on their symptoms and your evaluation, or is there a test?
Particularly for an older person, I'd recommend you get the lung tests that we call pulmonary function tests or spirometry, and you may have to have them done a couple of times because if you're not having a problem, they may not show up as something that's suggestive of asthma, but that's usually more a confirmatory thing.
Mm-hmm. Some of these medications, do they react well with other medications, or like anything else, or some danger or we need to be aware of all the medications someone is taking, or are these harmless?
Well, you always want to know what else you're taking. The main thing we sometimes see with asthma medicines, the quick relief medicines can speed your heart rate up, and the controlling medicines are usually steroids, and if you don't rinse your mouth out after using them, you can get thrush. So they're really the two most common side effects we see.
Does asthma get worse, or can it progress into something else?
As time goes on, lots of older people, you can actually get asthma as an older person. People kind of think, well, I'm 70 years old, I can't have asthma. Well, that's not really true. But most people who are older had most people have asthma as children, and then as you become an adult, because your airways are bigger, you don't have symptoms, and as you age and you lose some of that function, people tend to get symptoms back. So it does tend to come back when you're an older person.
That's an interesting, maybe a myth out there. What are some other facts that people may not be familiar with about asthma and how it affects them?
One of the things I was going to tell people, or an anecdote, was we planned a family vacation to the Barrier Reef to go scuba diving, and they would not allow my husband and daughter to scuba dive. So if you're planning a trip around that, you better make sure what the local certification rules are. So
that's interesting.
Yeah.
Well, if one of our viewers or someone they know may be suffering from asthma, what would you suggest they do? Where do they begin that treatment process?
Well, everyone likes to Google things now. So if you're going to look it up first before coming to the doctor, I'd say do the cdc.gov website. That's a great place to start for information. And then if you think you have it, come see a doctor, and he may want to run some extra tests to confirm that. That's where it starts.
Okay, great. That's great information, and thank you for being here.